Hey guys, my name is Rich Severin. I'm a physical therapist with a board certified specialization in cardiopulmonary. I'm also finishing a PhD in cardiorespiratory physiology and obesity. So I look at how the heart and lungs, specifically breathing, how that changes during exercise, in patients who are healthy and in patients who have medical conditions, particularly obesity. So there's been a lot of misinformation regarding masks and safety with COVID, right? And I want to put a lot of those kind of to bed. One of the main concerns people have brought up is that, well, these masks, right? This is a surgical mask, makes it harder to breathe, right? Well, I guess if you could think of it in an absolute terms, well, yeah, it's going to make it maybe a little harder to breathe compared to not having anything in front of your face. But the resistance imposed by this is exceedingly low, right? If you wear a scarf or you wear a face guard in the winter, it's about comparable to what you're going to get breathing through a mask, right? These are really effective for stopping droplets that you project out of your mouth and maybe preventing droplets projecting from other people's mouths, right? That's why we wear these in the hospital. That's why our patients, when I worked in a heart and lung transplant center, would wear these whenever there was concern about infections. And my patients pre-transplant, means your patients with end-stage lung disease, end-stage heart disease, would wear these, end-stage heart failure actually, would wear these walking into our clinic to make sure that they don't get an infection, which would preclude them from getting a transplant. So these are the most severe cases of lung disease, of heart failure, and these patients were able to wear them without much issue. And again, nurses, physical therapists, surgeons during surgery wear these. Surgeons wear these for hours in surgery without problems, right? If this was a safety concern, we'd have to revisit a lot of things we do in surgery, and these are safe, right? So the argument people say, well, resistance to breathing, it makes it harder to breathe. Well, I'm going to help, hopefully through a series of experiments, show you that the resistance to breathing with this is negligible, especially comparable to things that we have patients with breathing issues do in clinic. Okay, guys, so our first experiment, we're going to look at how strong my breathing muscles are. To do that, we're going to use a device called the Powerrate Cage 2, probably the industry standard for looking at maximum inspiratory pressure. What is maximum inspiratory pressure? That is the peak pressure that I can generate by breathing in. This is the most widely used assessment of respiratory muscle performance probably in the world. What it will involve is I will fully empty my lungs and take a maximal breath in. This device will calculate the peak pressure by measuring the flow that comes across this device over a 2-second or 1.5 second to 2 second average, and then it'll get us the pressure I can generate. That pressure we'll use for other devices when we start imposing load and start making our muscles work a little bit harder. So I'll clip my nose. So we focus everything on one area. I'll breathe all the way out. Place the device in my mouth. All right, let's see how we did. Okay, so I got a 78, which is not super great, but most people should get around 80 to 100, not super terrible, right? All right, so we'll do another trial, and then we'll see how we do with that one. Okay, trial 2. Let's see how we did. 81, so we'll go with that one, the highest one. Okay, guys, for our next experiment, or the first breathing resistance experiment we're going to have, we're going to use the threshold trainer. Now, the threshold trainer is a pretty low-tech respiratory muscle training device. What this does is imposes resistance to breathing by a valve at the end here. So when I take a breath in, I have to generate enough pressure to allow the valve to open. I can ratchet this pressure up by turning this this little dial down or up. So we have a valve attached to a spring. So if I make the spring tighter, the resistance is higher. If I make the spring a little bit looser, resistance is lower. Really easy to set up. As I mentioned earlier, resistance from a surgical mask, here it is way lower than anything that I'm going to impose from a threshold trainer, okay? So we determined that our peak pressure that I can breathe in is about 81 centimeters of water. Centimeters of water are the pressure units that we use to assess the respiratory system. That's pretty similar to a millimeter of mercury, which you might see mmHg with your blood pressure. A centimeter of water is about 75, I think, percent of a millimeter of mercury. So they're comparable, roughly. It takes about 5 to 10 centimeters of water to expand your lungs for a normal breath, right? So, not a lot of work we typically do, and these aren't really ratcheting up the resistance because, again, it's a piece of cloth. Now, for training protocols in most settings, we will train people between maybe 25% up to sometimes 80% of their peak pressure. So we measured my peak pressure at 81. And so for that would be roughly about 16 centimeters of water, which again will be exceedingly higher than what it will be imposed by a mask. So we'll set our device to 16, and then we'll start our experiment. So to measure how these devices will be impacting breathing, I'm going to use our little thing called a pulse oximeter. A pulse oximeter measures the amount of oxygen bound to hemoglobin, right, or how well it's saturated. Typically, that's going to be between 95 to 100%. We use a pulse oximeter to spot check patients to see how well their respiratory system, how well they're perfusing their body. Again, 95 to 100 is typical. You can see here the top number is SpO2. Bottom number is my pulse rate. That's up a little bit because I'm talking. It's also a little hot right now in my apartment. I'm going to keep this up so you can watch it while I breathe against this threshold trainer. So I'm going to attach my mouthpiece. Right? And again, we set it to a resistance of 16. You guys can see that here, 16. Okay, I'll place the device in my mouth and we'll begin to breathe. And we'll do it for about a minute to show you some of the changes that can occur during breathing. I'm actually going to use a metronome to make sure that I don't hyperventilate, which will indirectly bias my breathing, right? So I want to make sure I breathe between 12 to 20 breaths per minute, because often if people hyperventilate, they breathe a little bit faster. It's going to make these numbers artificially higher. So I'm going to keep my cadence at a normal rate, just to not influence the measurement here in pulse oximetry. So I have a metronome playing here at 12 beats per minute, and we'll breathe every time we hear the beat. So again, starting resistance, again at 16 centimeters of water, pulse oximeter on, 96 to start, and then we'll hit our metronome. You guys can hear this? Ooh, let's play it. Okay. So, as you can see, I'll pause this now. As you can see, my pulse oximetry didn't change. Actually got a little bit better. But at most, negligible changes, right? And even with the resistance taken off, it's come down a little bit. It's not changed much at all. Okay, 97 again. Anything between 95 and 100 is normal. So some people may say, well, your nose, you're still breathing normally through your nose. There's no resistance there. Well, we can clip my nose. Now, typically that's not what we do in training because you breathe through everywhere. But just for the purposes of this experiment, we'll clip my nose. Okay, guys, now we're back to our second experiment for breathing resistance. Again, just to dispel any concerns, well, hey, you're breathing through your nose, you can still get normal oxygen. Well, I'm going to clip my nose. And now I won't have not only resistance to breathing through my nose, I'll have nothing coming through my nose. So it would be even worse than you probably get with a mask. So we'll clip it. Pulse oximeter on. Okay. 95. So again, normally, you see my nose. If I take a breath in, it'll expand, it's clipped, nothing's coming through here. Nothing's coming through here, okay? So, 95, let's start again. Start our cadence. So, as you can see, breathing against 20% of my peak capacity, against exceedingly higher than a mask, negligible impact, and my saturation got a little bit better, and we kept the breathing cadence consistent. I also want to mention that I also have asthma. I do have a lung condition myself. So again, mask, first experiment, not very concerning. Well, some of you may say, well, 20% is pretty low. Let's actually see you put a little bit more resistance. Well, we can actually do that, and we'll do that in our next experiment. So people say, well, 25% is not enough. I want to see you work really hard. Okay. So again, most training protocols maybe go between 60 to 80%, start at 20%, but our goal is to get that high. So like we mentioned, my peak pressure was, about 81, centimeters of water. We're going to go up to 41, the highest setting on this device. Again, this is exceedingly higher than anything you're going to breathe against, right, from a mask, okay? So ratchet it all the way up. Highest it goes, 41, right? So this valve is pretty ratcheted up. And I also want to stress too that air can literally not get through here if I don't open the valve. So for me to get any air in, I have to open this valve. So again, I have to overcome 41 centimeters of water pressure. For me, that's 50, 55% ish of my peak pressure. We're a little limited by the device here. That's pretty high. Okay, so we're going to demonstrate this in our second experiment, or our second part of this second experiment. So maybe our third experiment. So we're back. We're at our higher resistance. Again, we're at 41. We got our pulse ox on. Again, we'll start nose opened up. Start our cadence. So again, minute of breathing, oxygen concentration didn't get worse, got actually better. Recovery rate's about the same. Breathing cadence is the same. And again, the only way for me to get air in through the valve is for it to open. Now we're going to do the same exact thing as we did with the lower resistance, now with our nose clipped. Like the second part of our first experiment with resisted breathing, I'm going to be clipping my nose. That way, there's still no air coming through my nose. Again, this is typically not what we do in rehab settings, but just for the purpose of science, I'm going to clip my nose to, again, put the kibosh on this narrative. Now, again, we're going to be at 41 centimeters of water, which again is exceedingly higher than anything a mask is going to impose, right? Surgical mask or a cloth mask. Now, I'm going to clip my nose here. Again, the only way I will get air is breathing through this resistance. Again, we'll use our cadence here. We'll monitor with the pulse ox, and we'll begin. So I'm going to clip my nose. Again, no air is coming through here. Device in. Pulse oximeter on. We'll start our cadence. Again, this is not particularly comfortable because my ears probably will pop. And it's not the nicest thing. So again, we're starting at 96. So again, like our previous experiments, I was breathing at close to 50% or higher than my peak pressure. Again, exceedingly higher than this mask. My pulse oximetry didn't change. I worked pretty hard, right? My breathing muscles, my diaphragm, my intercostals feel like they've worked out a little bit. But again, fine. Not lightheaded. Pulse oximetry is normal. Heart rate's up a little bit because I'm talking. just kind of worked out my breathing muscles a little bit, but nothing, no changes, right? Again, exceedingly higher than what you're going to get from a mask. Now, some of you may say, well, we're still able to breathe out sort of through the device. Well, fortunately for you, I have a device that can challenge that a little bit too. And we'll do that for our next experiment. So for our final experiment, we're going to use the device called the breather, right? So the breather is a device that loads or provides resistance both to breathing in or inhalation as well as expiration. The resistance isn't as specific as maybe our threshold trainer or our power breathe trainer here, which can also do training and testing. But it does inspiration and expiration, right? So we've got inspiration on here. We have it to our highest setting, 6, right, for inhalation. And then our highest, it goes for expiration here, or exhale, same concept. I'm going to breathe in, right? So I'm only going to get air through this little orifice here, right? So no matter the phase of breathing, I'm going to have to breathe against resistance. Again, exceedingly higher than what's going to be provided from this mask. And we'll be able to monitor what my pulse oximetry does during resisted breathing. Again, we'll see how it goes. So again, for our final experiment, we're going to use the breather, right? And again, just to dispel any myths that this is something that I rigged up. I literally just got this from PM Medical. Still have the packaging right here, right? This is still pretty new. So let's get our pulse oximeter on. Put it on. You guys can see here. Normal. We'll start our cadence. Again, we'll start with nose open, then guys will be able to see the changes acutely. So again, breathing resistance through both cycles, no change. And just like our experiment with the threshold trainer, we'll do the same thing now with my nose clipped. And again, that will restrict everything just to one area and exceedingly higher resistance in the mask. Final experiment, still got our pulse oximeter on. We'll put our nose clip on. Again, nothing's coming out of here. And this is going to be very uncomfortable for my ears because I'm getting resistance either way. My ears probably will pop a few times. Swimming in the Lake Michigan today. But for science. Okay, make sure it's tight. Again, we're at 5 for expiration, and we are at 6 for inhalation. Resistance as high as it goes with this device. Pulse oximetry, 97 to start. Pretty normal. And let's begin. Look again. Resistance was provided through both cycles of breathing. I had my nose completely clipped. And again, pulse oximetry, we had a couple seconds where it was in 94, which is not really a concern either. And for the most of the times at 95, 96, went up to, I think, it increased even a little bit too. So again, let's put this myth to bed. This is exceedingly less resistance than this. And as we just shown you guys that there's no changes here. We kept breathing cadence consistent. There was no hyperventilation. There was resistance to breathing higher than whatever is going to be imposed by a mask, and nothing changed. Yeah, I'm probably a little tired now because I had, a lot longer than we typically do respiratory muscle training. Typically do this for maybe at most 5 minutes. I just did maybe probably about closer to 10 minutes, and I was still fine. And again, while I'm young, I do have a lung condition myself, and I'm, a little bit overweight. And again, not a serious concern. And again, like I mentioned, patients with lung conditions would wear these routinely. And we would also often train patients with lung conditions using these devices, right? We would use these often, and that's kind of what we do. So let's put this myth to bed. Hopefully this was useful to you guys, and if you have questions, feel free to leave them in the comments. I hope this was helpful. Thank you so much. Take care.